Hey, Jim Hoffman here for EMS Office Hours. This is your Monday Minute, guys. We are finally wrapping up the Respiratory Emergencies section of these EMS Quick Study Tips. And this is going to be a quick one because it's on hyperventilation syndrome, the HYS, the people that are breathing 100 times a minute and they call for chest pain and shortness of breath and all these various complaints, right? But there's some key elements that I want to talk about when it comes to this emergency. Okay, but before we do that, of course, I always like to talk about why this stuff is so important. And I always tell you it's not just for exams, right? Although there is key information in these quick study tips videos that will help you pass exams, it's also to help build your knowledge base. It's hopefully getting to ring a bell or two so you go ahead and research or delve a little further into these topics so that you really can master them and build that knowledge base to help you, of course, go and be better for your patients by making better clinical decisions, writing better reports, and interacting more effectively with other healthcare providers, whether it's doctors, nurses, and even your partners, okay? So keep that in mind when you watch these videos, all right? Yeah, there's key information here, some bullet points that we go over pretty quickly, but I'm hoping that if something doesn't ring true to you or it's a little confusing, you're not quite sure where it's coming from or what I'm talking about, that you'll go research it, whether it's your textbook, whether it's Google, whether it's a resource like TurboMedic, whatever the case may be, you'll go ahead and do that and get more information and master that topic and again, build that knowledge base, right? Even if you move that needle just a little bit, it's going to benefit you in the long run. All right, so real quick, guys, hyperventilation syndrome, okay? This, of course, is when that respiratory rate is just way too high. It's greater than that's required for a normal human body to function. Okay. Now keep in mind, a lot of disease states out there that can actually cause hyperventilation, right? So don't assume that it's just anxiety. Okay. So when we talk about disease states, what are we looking at? Well, think about it for a second. Of all these different things here on the screen that can make a patient breathe faster than normal, right? Asthma, COPD, they're having a heart attack, diabetic ketoacidosis, CHF patients, certain drugs, okay, even things like psychogenic factors, okay? All this stuff can make a patient breathe faster than what they normally would need, okay? And of course, we're going to treat these as we see them, right? So the idea, of course, is to narrow it down to see if it actually is just simple anxiety. It's just simple hyperventilation, right? So when we're looking at these patients, there's a lot of things they can present with that mimic other things. Chest pain, dizziness, they can feel faint. They can have classic things for hyperventilation, really, that numbness and tingling in the extremity, that carpal tunnel syndrome, okay? And the mental status, the oxygenation isn't really there for them, and they can be tachycardic or feel that they're having palpitations. Okay, so these are some of the complaints that a patient might have. So for us as providers, it's to kind of narrow down what it is that's causing it. Okay, so again, don't always assume that it is anxiety because of all the other disease states that are out there. Okay, so how are we managing it? Well, we want our ABCs, of course, oxygen as needed if it is something that we might consider one of the disease states like asthma and an MI or something. If we really think it is that hyperventilation, we really think that it is anxiety, okay, what do we want to do? We want to kind of coach the patient. This is where that bedside manner comes in, where you really have to have that patience and kind of coach the patient repeatedly. It takes a while sometimes for patients, right, to help them slow down their breathing, okay, because sometimes they are their own worst enemy, right? If they're breathing too fast, they can't slow it down. So you have to try to coach them to do it. Take deep breaths in, hold it for a second, let it out, right? Things like that, okay? If they have chest pain, you might want to start an IV. You might want to do an EKG. You might even consider treating that chest pain, okay? If you look it up, there's actually some research that shows that people who come in complaining of chest pain and it looks more like anxiety, a lot of these patients are having a cardiac-related event. So you've got to be very careful Don't just blow it off as being anxiety. If they're having chest pain, go ahead and do an EKG, okay? Rule that out, okay? Transport them into a position of comfort as well, guys. And on a side note, these patients too, depending on how far along they are with this anxiety and the hyperventilation, and they're really kind of freaking out, right? Some protocols where you are, you might be able to give them something to help calm them down. Maybe some Versed, maybe some Valium. Depending upon where you are, what your protocols are, you might be able to go ahead and give something to that patient to help calm them down, which in turn, of course, helps slow down their breathing. But the key thing for me, and then I hope you're going to take away from this, is that not to just blow it off every hyperventilation sort of presentation as being just anxiety, right? Do your full assessment. Rule out all the things that we talked about, all the other disease processes that might be going on. Get a history. See what led up to the event, okay? Was there stress involved? Is there something going on in the patient's life to make them anxious and make them to a point where they're going to hyperventilate, right? Think about all that stuff, guys. Your full history, what's going on with the patient, do your assessment, and this way you'll be able to understand what's happening and you'll be able to rule out whether it is actually hyperventilation or maybe it's something like asthma, COPD, an MI, something like that. Okay? Guys, I hope this makes sense to you. I hope you'll go ahead and join me. Follow me on some of the social media platforms out there. I'm on Twitter and Instagram at EMS Safe. And you can get me on Facebook as well. And I'm at facebook.com/the EMS Professional. So engage with me on these platforms, guys. I do a little something different on each one of these platforms. And guys, if you want some more help to help you succeed, get better education, and in turn open up some opportunities for you and even your patient. You think about opportunities, right? Opportunity for you to give them better patient care. Go check out the main site. It's emsseo.com. Lots of study help there, exam help, stuff to help you move that knowledge needle, right? Give you and your patient that unfair advantage. I did a podcast about the unfair advantage recently. Go to emsofficehours.com. You'll see the podcast there where I talk about that unfair advantage you're giving your patient by increasing your knowledge base and moving that knowledge needle a little bit. Okay, so I hope that makes sense, guys. Check out the main site. You'll see a lot of stuff there I think you'll find very useful and very informative and will help you in your EMS career. All right, guys, again, that's it. We are done with respiratory emergencies. Next week, we are going to start with cardiovascular emergencies. This is going to be another long chapter. We're going to be getting into it for a little bit, right? We're not going to go over really EKGs like that, but we're going to go into a lot of other things like blood pressures, myocardium, pulmonary circulation, systemic circulation, all that type of stuff, okay? That's going to be next week. We're going to start off on that. In the meantime, if you have questions, comments, concerns, send them over to me. It's contact@emsofficehours.com. You can also get a hold of me on any one of those social media platforms. You can send me a DM or a private message there. Okay? Let me know what you want to see here in the Monday Minutes too, guys. I can always break away from these quick tips and do something that you want to see here on the Monday Minute that you think might be useful for EMS providers out there in the field. Okay? All right, guys, that's it for me. As always, I am Jim Hoffman for EMS Office Hours and the Monday Minutes. Stay safe.